The On Our Own centers across Maryland are the longest continuously running statewide consumer network in the nation. And we've been holding these statewide conferences since 1982. And you being here today, shout out to all of our first timers who this is their first conference. Thank you for being here. But you being here today makes, let's do a real round of applause. Let's definitely, first timers. Thank you, good. You are part of our family tree now. And our tree is full of beautiful chirping birds, having a lot of conversations and hatching ideas and developing the programs for the future. Because once upon a time, the Anti-Stigma Project, our TAY Transitional Age Youth Project, the concept of peer certification itself were just ideas hatched by peers coming together and dreaming about how we can make our system truly trauma-informed, recovery-oriented, and healing-centered. And the state of Maryland has been a partner in every step of that journey. And in the last few years, they have supported an absolute abundance of peer support throughout the system. Peers in places that peers, were, but weren't recognized before. And now we have so many jobs and opportunities for peers in leadership roles, in service roles, and support roles across the system. And so we are so honored to welcome our Deputy Secretary for Behavioral Health, Alyssa Lord, to be in community with us today and to share her vision for growth. Alyssa stepped into leadership at the Behavioral Health Administration just last summer. They say in bamboo, it grows so fast you could actually hear it grow. I feel like that's a pretty apt metaphor for you having to come in to our world. But you have brought more than 20 years of experience working collaboratively across local, city, state, and federal partners to improve health outcomes for folks along the whole lifespan. Alyssa is deeply committed to healthcare as a human right and a matter of social justice, and you truly jumped right in, digging into the challenges and the opportunities that are facing our system today. So please join me in very warmly welcoming to our stage, Deputy Secretary Lord.
Good morning. We can do that again. Good morning.
Good morning.
Much better. Thank you. We are here in beautiful Ocean City, Maryland. We have extraordinary weather. I woke up to a pink sunrise and hearing the waves crashing, which is different than my normal morning of my 5-year-old arguing with me about chocolate chip pancakes and my 9-year-old wanting to know if she can wear a crop top. So I appreciate a pink sunrise and some wave crashing every once in a while. And I want to thank On Our Own of Maryland for welcoming me, and thank you to Katie for the very warm welcome that I have received since uprooting my family in 6 weeks, which I don't recommend that. It did also come with a bribery of 2 puppies for my kids. I also don't recommend securing 2 puppies at the same time. I realize there is value in support animals, but 2 puppies, training them while starting kids in a new school and moving into a house, probably not the best for my mental health. And so I am grateful for the peer support that I received during all that transition. In light of that, I do want to take a moment to acknowledge the 2024 award winners that are in the room with us today. So a round of applause. We have Sue Deal, who received the Lifetime Achievement Award, Baltimore City Strong, and all the work that Sue has done around community-based behavioral health care services. And when I talk about the continuum in a minute, you'll see just the role that community supports have figured prominently into what we're thinking about for behavioral health. I also want to take a moment to honor the memory of Cynthia Pettian. Many of you may have known Cynthia, and we unfortunately lost her last year. And she received the Visionary Award posthumously, but I'm sure we carry her spirit with us as we move forward. Main Street Housing, Mr. Wireman, 25 years of housing, and the pivotal role, I know Ms. Hilton talked about this, but the pivotal role that housing plays, it's oftentimes where it's perspective, right? Having a roof over our head, having clothes on our back, having food to eat, sort of the core necessities that we think about that drive us throughout the day, and housing plays such a critical role. So thank you for the work that you and your organization do. The President's Award to Carolyn Collison, who is an extraordinary leader and advocate. So thank you for all the work that you've done in supporting the peer network. The Michelle Deer Advocacy Award to Donna Bruce for the work that she's done on overdose, family peer support, and we talked just a fair amount about trauma, but we should always be talking about trauma. So thank you to Donna. The Luann Townsend Courage Award to Diana Flores for the work that she's doing in being an emerging leader and innovator in bringing peer support into the Hispanic and Latinx community. And we know, unfortunately, as a result of what happened with the bridge collapse, that the families that were predominantly impacted were those that were Spanish speaking. And so the critical roles that peers have played in supporting those families and the trauma that they not only experienced a couple months ago, but are now going to live with for the rest of their lives, we are working to ensure that peers and the supports that they need will remain ongoing. So thank you to Diana for the work that you're doing there. And then last but not least, acknowledging Najma Durrani through the Gus Ratalis Exemplary Service Award. And, when I was talking with Katie, Najma makes peers fun and accessible. And what I would like to posit is peers, from my perspective, are always fun. And so in this room, it's just an honor to be able to celebrate that. And so thank you and congratulations to all the awardees. And before I jump into a PowerPoint, everybody's favorite, I wanted to just talk a minute about why peers are important to me. And so when I was 12, and I had the opportunity to briefly talk about this, but my parents made a career decision to leave the corporate sector when I was in my teenage years and moved to the nonprofit sector. My father went to work for a community redevelopment organization in Trenton, New Jersey. I don't know if have ever visited Trenton, but they are known for the bridge that what Trenton makes, the world takes. And unfortunately, when industry left, many things were taken from Trenton, except the spirit. And then my mother, who is a social worker, although she will never retire, even though she's technically retired. She worked for a nonprofit that supported predominantly women and their families who've experienced interpersonal violence. And so at 12, my parents said, "You're coming to work with us." And I said, "Okay." And so, I gave them a little pushback. I was 12. But at the end of the day, it was some of the most formidable experiences that I've had. So in the organization with my father, they had built community gardens. And what I didn't realize was that was sort of the first exposure that I had had to peers, because it was individuals in the community that came together to grow something beautiful, to take back something that they thought that they had lost in their community, which was green space, which was joy, which was camaraderie, which was safety, which was communication, which was support of one another. And what I saw was sort of this notion of like reach one, teach one. So as new members would come into the community, they would see the garden, and we would see, sometimes they would mosey, sometimes they'd be hands in. But those that had been the legacy members of the garden welcomed everybody, and they taught everyone how to cherish the garden. And then what was happening is that these community gardens were growing all over Trenton. And so there got to be a fairly healthy competition among the community gardens. And what we also found, though, is that people really wanted to be a part of those communities. They went there for safety. They went there for solace. They went there to share their grief. They went there to show their resilience. And so annually, we did something called the Harvest Dinner. And it was an opportunity for all of the different gardens and all of the different communities to come together to share in their culture and their experiences and their happiness, and sometimes their sadness of individuals that they may have lost throughout the year who had been tending to the gardens. But it really was formidable for me to understand the role that individuals play in supporting others, whether it be through gardening or just hanging out in the garden or walking around the perimeter of the garden. It was about community. And that is what On Our Own of Maryland so deeply represents. And then with my mom, this was, again, early on. I'll probably be giving away my age, but this was in the late 1980s, early 1990s. And so at that point, women who had been surviving interpersonal violence, many of them were living in residences where we weren't allowed to disclose their addresses. And we were really working to maintain their anonymity and their safety of them and their children. But what they formed was a very vocal and strong and an amazing community for one another. And so the organization that my mother worked for started hiring the women that were living in their residences because they realized the tremendous inroads and the respect, and again, I'll root on the word safety, the safety that other women felt coming into the program, being able to talk to somebody who had gone through what they had experienced, and created the ability for them to talk and feel nurtured and loved and supported in a very different way than they could have received through other sort of therapeutic environments. And I think Ms. Hilton talked about this a little bit around the disconnect sometimes that we see on the clinical side when people are trying to get care. And I'm not negating the role of the clinician, but it is a very different experience when you can be vulnerable and open to somebody who's gone through what you've gone through. And the organization that my mom had worked for, they said, how do we find a way to fund this? And so what they had done was, this is when AmeriCorps Vista came out. Again, aging myself a little bit. And so they had gone back to the feds and said, we know these dollars are supposed to be for college students. College is important, giving them opportunities to reduce their student loans and all that. We get it, but we want to repurpose these dollars so that we can hire our women so that, they have a sustainable career path. And that is what they did. And then they figured out how to leverage other private funding to be able to continue to hire women. And that's really how they built their program. And then last but not least, because clearly this is something that is deeply personal for me, is I had the opportunity, again, early in my career, to work at an Ivy League university where they were they were asked to take over a school that was failing in West Philadelphia. I'm sure you can put together the Ivy League with the West Philadelphia reference. And so there was a very, very strong community sense. I will say, though, the school was on 58th Street, which was sandwiched between 59th and 60th Street in West Philadelphia, of which there was gangs on either side. And so we had an agreement with the gangs that between the hours of the school, all bets were off. Nothing could happen. And what we did is we actually had our youth, our kids, they led the efforts around what was it that the school wanted? What was it that the parents wanted to see for the school? They led our community health needs assessment for the West Philadelphia area. They informed the types of services they thought we should be bringing into the schools. And it was powerful, and it was deep. And it was a moment in which, when I had first started, I asked my kiddos, I say kiddos, although almost all of them were taller than I was, I said, what do you want to do after you're 16? And they said, 16? Like, we're just trying to make it through where we are now at 12 and 13. But by the end, they were thinking, and again, it was very much, it takes a village, right? It was all hands on deck. But we started to have some of our youth start to talk about, well, maybe I want to become a teacher, and maybe I want to become a pastor, or maybe I want to go and do what you're doing. And I was like, okay, you can take my job right now. And there was a moment for me in which, just several years ago, I was at a meeting back at the University of Pennsylvania, and I see a young lady who's sitting there because I was about to tour the hospital. And I go, by golly, I know her. I was like, that's Chasu. Mind was blown because Chasu was one of my kiddos who was now a community health worker for the University of Pennsylvania. And I just was like, it was such a moment for me of realizing the power of, again, community, the power of how we think about what peers look like and the role and influence that they have. And so when this opportunity was offered to me to move to Maryland, and I learned about the tremendous work that we do, the tremendous work that peers do in the state of Maryland, I couldn't have been more excited. I know we do a lot now, and there's a lot more that we need to do, but with you all in this room, we'll get there. And for those of you that are not in the room yet, or if you know of people, get them on board, right? Like, this is one of those moments where drinking this kind of Kool-Aid is the good Kool-Aid to drink. So with that, I want to spend a few minutes just sort of talking about what we're doing in BHA with a heavy emphasis on the role of peers. So I appreciate you letting me ramble, but it more so just goes to show how deeply committed I am to peers and the work that we're doing in peers. So can we go to there's the clicker, right? Well, we're going to try technology here and see how good I do. Oh, hey, it worked. Progress. Okay. So what we've done here in the state of Maryland is really just tried to figure out how do we organize our services, which there's something called the Behavioral Health Continuum of Care. I don't know how many of you are familiar with it, but it basically says the who, what, where, when, why, and how people are accessing services. And with the new secretary, Secretary Herrera-Scott, who joined the department a little more than a year ago, who also sends her regards and is also a big fan of peers. Dr. Herrera-Scott, for those of you that don't know, family medicine physician who early in her career and spent a lot of her career caring for those that were HIV positive, SUD, intravenous drug users in Baltimore in her career. So she also understands the role of the peers, and so for her, that a lot of time that informs her framework. But when she came in, she said, I need to understand, what are we doing, right? Where are people getting care? Where are we missing how people are getting care? And so what was constructed was the Behavioral Health Continuum of Care. And we basically put it in buckets to try and simplify the process. Prevention, promotion, primary behavioral health, early intervention. That is where we do a lot of work around children, adolescents, and families. Urgent and acute care, which is a relatively new service line for us, which is around crisis and crisis stabilization, and then treatment and recovery. And so underscoring all of this is how we think about utilizing data, how are we evaluating the quality and outcomes of services, how are we making sure we have the workforce, which is inclusive of peers, to support all this work. And you heard during the last speaker talk about how we need to think about how we diversify the workforce, right? Workforce is critically important to executing on this continuum. And last but not least, how do we think about the role of health equity? How are we thinking about how when I walk in the door versus my husband, who happens to be a Black man, receive services, we know, because we've gone to the same practice, how I receive care and how he receives care has been dramatically different. And I've witnessed it, right? So like, these are the types of things that we have to think about. So what that leads us to is, what are some of the things that we're focusing on? You heard me talk about workforce, and I'll get to peers and the investments that we're making in peers in a few minutes. We're also talking about, how do we work together across the state? Silos don't work. They're highly ineffective. It leads to a fragmented, broken system. So we are working really, really closely with our friends in DHS, DJS, and MSDE. Not like y'all need any more acronyms in this world of healthcare, but we have them. There's some work that we're doing around how we think about evaluating the services. And again, this is called value-based purchasing. It's a concept around healthcare financing. But what it really says is, we're going to tie money to your performance. So for those providers where we're seeing better health outcomes tied to health equity, we're going to make sure you get paid a little better so that we can continue to invest in those services and supports. There's also something called CCBHCs, which are really meant to be coordinated systems of care, of which, by the way, peers are a required component of CCBHCs. Yes, absolutely can clap for that. And some of you may be aware, this past legislative session, after 20 plus years, we were able to approve AOT, or assisted outpatient treatment, which again has a peer component that is a requirement of the legislation. School-based health centers we're doing a lot of work with our schools to try and figure out, how do we address the upstream factors and get kiddos and families into care. And as you heard me mention a lot about outcomes, we want to know, what are we doing well and what are we not doing well, and how do we fix it? And then last but not least is, we do need to be mindful of technology and the role that technology plays. And we did hear about, right, this notion that there's a gazillion apps that you can sign up for, but is that really always going to be the right method to get people into the care that they need? So something that we're taking a look at. Next slide. So again, where we're focusing some of our efforts: suicide prevention and problem gambling, veteran services, peers. I may just fast forward to that in a second. Actually, I'm going to get to it in a second. You heard me mention mobile crisis stabilization. That is my time up? Okay. I feel like, I'm at an awards ceremony, like the music about to play, get off the stage. Or a gong. There's also a peer component for mobile crisis and crisis stabilization. We're doing some work around 988 and 911 integration so that we can make sure that the right team is being deployed to care for individuals when they are in crisis, and that work has just kicked off. And then we're also thinking about, how do we make sure that individuals get the right setting of care at the right time? So the most restrictive setting of care, being in an institution, is probably not always the right place for people. So there's residential rehabilitation programs, there's assisted living programs, there's permanent supportive housing, lots of work that we're doing around housing, and then the wraparound supports, which again is another opportunity for peers to play a pivotal role. I won't bore you necessarily with the policy and planning side of things, but we are really looking very, very closely at our provider network and making sure that we are having quality providers render the care that we need. And it is also tied to money, though, that I will say. So we oftentimes get people's attention because we are thinking about, how are we driving the dollars that we have? We are the stewards of the dollars of the state. We need to be spending them wisely. And so we are taking a look at quality, compliance, performance, and outcomes. And then lastly, there's some work that we're doing around making sure that we build our infrastructure so that we can be responsive to the needs. And then we also have a small but mighty team that oversees all the residents' grievances. So any patient or individual in the community that has a complaint around behavioral health services, which is inclusive of mental health and SUD, it comes to our team, both for those that are living in institutional settings like Spring Grove or Springfield Hospital, but also for our provider community. So we are the repository for that information, and we are charged with acting on it. With that being said, let's get to what's the most important. We'll talk about peers. And I don't know, some of you may be familiar with the great team that we have at BHA, but I do want to just give a shout out to Brendan Walsh, Brendan is extraordinary, and he is my barometer on all things peers, and just in general. He's great for many different reasons, but I can't take credit for some of this. This is all Brendan's hard work. So the next time you talk to Brendan, please let him know that he certainly deserves the kudos. So here is a brief timeline of the history of peers in the state of Maryland. So it's really been over the past 2 decades that we've seen the extraordinary growth in peers. And so in the early 2000s, we saw an uptick in the number of behavioral health providers that began to integrate peer recovery specialists into their staffing. By 2013, Maryland adopted the Certified Peer Recovery Specialist credential. By 2018, the Maryland General Assembly introduced and passed House Bill 772, and this required MDH to convene a stakeholder work group to provide recommendations related to the reimbursement of peer services. And then in 2021, with the ARPA, this included a temporary increase to Medicaid funding, and this created the opportunity for Maryland to start to think about how we reimburse for peer services. And then we also are working with the University of Maryland on an ongoing basis to understand our peer census. And so let's actually talk to what's happening in the state of Maryland with peers. So twice a year, there's a survey that goes out to all of our local behavioral health authorities across our 24 jurisdictions to monitor the growth of the peer recovery specialist workforce. In our most recent survey, there were 333 funded peer positions in Maryland. And so, this is meant to demonstrate that our workforce remains strong, and we are looking to continue to move forward with expanding the role of peers. And again, I want to thank you all for being here, taking time out of your day, and it's really just an acknowledgement of you and your hard work. Let's talk about funding, because as I said before, money is important. We need to make sure that we continue to have the funding to support this work. And so what you will see here is from fiscal year 24, there's been an overall investment through fiscal year of 24 of more than $26, almost $27 million in peers by the state of Maryland, with an anticipated, yes, it may not be enough, but it's a good place to start. And then we're anticipating an additional about 10% growth to looking at about 29 million going into the next fiscal year. And then the other piece I want to talk about is the creation of the peer specialist career track. And so we want to make sure that this is a sustainable career path. And I know Katie asked people to raise their hands about, your history and your trajectory and whether you got paid or not paid. But this is something that does remain sort of top of mind for the Department of Health. And so, we created salary grades for peers, and there are the 2 position job classification expansions. And so we actually also do an annual salary review based upon, this just comes with the joys of working in state government, but I actually think it's the right thing to make sure that we're attracting and retaining a great workforce. And so, this is work that is ongoing. And so what we did see is an adjustment in the salary grades by 1 grades for peers. So this is going to be ongoing work that we continue to advocate for to make sure that individuals are paid for the work that they do. One area I want to talk about is in the expansion, and you heard me mention crisis services. And so we are expanding our investment in crisis and peers, and that includes a $2.4 million investment that is funding 8 peer positions in 5 different crisis centers across the state. So again, this is how we're thinking about how we pilot this so that we get the information that we need to learn how to take it to scale. Katie, tell me if my time is up and you need to kick me off the stage. 5 minutes. All right, I will power through this. Some of these other things are things that you all might be aware about. You heard me talk about community. So we want to make sure that we're creating the opportunity for you all to connect to one another. So there's listservs, there's Facebooks, groups, and then lastly, there's a couple of other things that are on the horizon, which is, I went too fast in trying to get through it. Where am I at? I can't see my own slides. Okay. So we have the expansion of the expansion fund for peer certification. We have some, oh goodness gracious. I'm like, this is why I should never be allowed to drive my own PowerPoint. Oh, on my screen, okay. We had a whole joke about technology and the joys of technology, but hopefully I drive a car better than I do a PowerPoint. So lots of really good work that's happening. So we, as you heard me say, we want to make sure that we're expanding the peer support fund, and that work is going to be ongoing. We're doing some ongoing training. Oh, now my slides won't advance. There we go. We're doing the continuation of behind the fence training that was initiated in 2019. So that work is going to be continuing to be ongoing, and that is being done in partnership with the Maryland Department of Labor. And then we also have recovery-friendly workplaces. So this is a hugely critical and important initiative. And actually, I was at a meeting with the governor and Dr. Gupta from the White House Office on National Drug Policy, and he highlighted in particular the work that the state of Maryland is doing around recovery-friendly workplaces. So we're really trying to figure out how do we, now that we know how to get directly to Dr. Gupta, how do we make sure that this is something that's sort of top of mind and we can work with the federal government to receive additional funds for it. So we anticipate to onboard more than 25 businesses as recovery-friendly workplaces, employers, and support over 75 individuals. It's not enough. It's a start, but we know it's work that we have to continue to push on. And then the one thing that I do want to mention is the role of family peer support. And I actually had the opportunity to spend some time with Christy Green yesterday from the Maryland Coalition of Families. You know, the work that she and her team are doing and other organizations around the state around family peer support is absolutely essential. And so it's how we think about broadening the definition of peers, that we are ensuring that we're providing peer support across the entire lifespan. So I just want to thank those of you that are, whether you're designated or undesignated as family peer support, I think you all serve that role in that capacity. And with that, I will now shut up. But I just want to say thank you to everyone. It is my honor and privilege to be here. And if I could, I would stay the whole day because it certainly is, well, this is being recorded, right? Oh, then I won't say my next comment. But my heart is here in spite of having to go to some other meetings. Just know that. So thank you, everyone.